Hello again, this is Earl Silverman, Editor-in-Chief of the Journal of Rheumatology, welcoming you back as I highlight an important paper from the December 2024 edition of the Journal of Rheumatology. Today I will be speaking with Dr. Lisa Christopher-Stine, who is the first author of our featured article titled The Dermatomyositis Disease Symptom Questionnaire, DM-DSQ, a measure to assess patient experience of dermatomyositis. Lisa, I want to thank you for taking the time to speak to me and our listeners on behalf of all the authors of your paper and to discuss the findings of this very interesting paper.
Thank you. Thanks for having me.
So let's start. So could you please give us a little background to previous work done in this area and the rationale for then a new study?
Sure. So I think when we talk about quality of life and the negative impact that dermatomyositis has on our patients, frequently the way we assess patients is the way as physicians we assume that the disease affects the patient. And I think over my journey, when I think about patient-reported outcomes, I've done some of this work under the framework of OMERACT, which is outcome measures in rheumatology clinical trials. And as I learned in that journey, often physicians and patients may disagree on the way that the disease affects the patient. We've done work in this space in myositis as part of a special interest group in the OMERACT framework, but we didn't really highlight dermatomyositis as a subgroup. And skin symptoms did not rise to the level to take forward to look for instrument selection for that particular endeavor. So this essentially sought to, I think, be synergistic really to the patient-reported outcome work that we've done previously. Sorry about that. Which we've done previously, and looking specifically at dermatomyositis as it affects patients.
Okay, good. With that in mind, so what was the aim of this study?
Yeah, so we really want to conceptualize or try to understand the experience of dermatomyositis from the patient's lens and help to develop a instrument. Here it was the DM-DSQ, which is the Dermatomyositis Disease Symptom Questionnaire. And it was intended to be developed as a novel patient-reported outcome, trying to, I guess, encapsulate the experience of dermatomyositis, which would be primarily used in clinical trials because the regulatory agencies like the FDA like to see that there's clinically translated measures in outcomes, not just what does the data show, but how does it affect the patient. So that would be the primary goal here. And then something easy enough, hopefully, or so, to be able to be used in everyday clinical management, maybe even those outside of us that are specialists in the disease. So that was the idea of why to do the study.
Okay. And how did you do it? And how did you determine who to interview? I always
Yes.
wonder how people do that in these type of studies.
Yeah, so we took advantage of the Myositis Association group. So the Myositis Association is a patient-facing organization that's a patient-specific advocacy group. So these are self-selected patients, right? You have a call for patients. And so, one of the things I'll mention, and I'm always surprised that there was a very high education level. It's not always represented. I think I wonder about this disease in general, myositis. Whenever we have surveys, it seems to be a very high education level that answers that. So maybe it's a self-selected group. But the group itself selects, and we had certain criteria. You had to be an adult, you had to be diagnosed, either fill out a form from your doctor or meet certain criteria that we believed you actually had dermatomyositis. We then recruited that group. You had to be able to be a primarily English speaker or at least understand, read, and speak English. And we did select groups that represented different severities, so mild, moderate, severe, and we targeted about 50% for moderate, 25% for mild, and 25% severe. And we got really very close to what we had intended. So, and those severity symptoms were based on the way that the patient describes and experienced the disease.
And then, so what did you find?
Yeah, so I mean, it's not shocking, but the symptoms such as muscle weakness, rash, not surprising, they're the two main features of the disease. But I think again, what's interesting is that time and time again, we appreciate that fatigue and pain really do rise to the most impactful symptoms. I always I'm always impressed when patients remind me that the disease is experienced the way they experience it, not the way I necessarily learned it. And I think again, we've seen this in prior work, and it came out again that pain is something that patients really do comment on. This this questioning brought out a little bit more regarding social impairments and the way that patients are impeded in social gatherings, just because not only are they have functional limitations because of weakness, but rash and skin disease can be pretty disfiguring or limiting in a social situation. So I think we saw some of that come out. Self-care, mobility, social roles and the roles that they play, again, things that we don't maybe necessarily survey so much, and then emotional and social impacts. So that this, I don't know if you want to go further, but essentially this is a conceptual model now, right? So we have symptoms, we have functional impacts, and then different domains that don't necessarily make it into the instrument, but make us consider the way that things like brain fog,
Right.
emotional impact, anxiety, they all sort of, I think, draw into the instrument, but the main domains are muscle, not shocking, muscle
Yeah.
symptoms, skin, fatigue, and then some emotional and cognitive impacts.
All right. It's very interesting that you brought up things like brain fog, which honestly never associated with this particular disease. We
I
think
hear it.
about it in lupus, and but not in this. To be honest, I mean, that's fascinating.
I would say that interestingly, like we don't see CNS disease in the
Mhm.
sense the way that
Yeah.
we see it organically in lupus, but patients often talk about this symptom, and it's hard, right? It's a hard symptom to
Uh,
conceptualize and to measure. And so trying to have the patient, to the best of their ability, tell you the way they experience the disease and then try to find a validated instrument that does that gets a little trickier. But yeah, that comes up time and time again.
that's very interesting. I think we already addressed the core domains.
Yes.
And so this is interesting. So you did bring up, obviously, you identified new domains that should be studied.
Yep.
And so you had mentioned that the idea was to use this in trials. So what do you think needs to be done before it's sort of ready for prime time, as it were?
And yeah, and to be frank, and this is, it's stated in our manuscript that this was actually originally conceived. Sometimes pharma and academic partnerships
Right.
are good, and this was conceived out of a trial that was for ravulizumab that ended up being a trial that did not go on to further measures, but that they recognized that there was a missing instrument. So
Mhm.
obviously I think the hope was to use that in the context of that trial. But I think what's obviously needed is that it needs to be used in broader clinical trials. Obviously, we need to do more validation studies. It needs psychometric analysis, population and correlation studies. So I think until we have more longitudinal measures, and like I said, it's not so daunting that really one could not envision using it as a measure within one's clinical practice. And then we could at least look at test, retest, look at longitudinal
Mhm.
responsiveness. The IMAX, which is the clinical trials assessment group for myositis, has asked to add this to their list of measures and has distributed this to members. So I think it will take a concerted effort in the myositis community to start adopting and using this. But I think it really is, it's always, I think, encouraging to me when patients give the primary input through their own experience with cognitive
Mhm.
debriefing and really their concept model is what we should be understanding as doctors, the way that, the way the disease is experienced. So I hope it will be going forward in other trials and certainly in clinical practice. And or hopefully, the next you will see is that the validation models are continued, and that we see continued positive results, and that this is a responsive measure.
Good. I hope so. I think what we've learned certainly I've learned over the many years where it was doctor knows best and we'll worry about it. And now we realize that we can think all we want, but it's how patient feels at the end of the day that matters to your life, which makes so much sense.
I couldn't have said it better. And I'm so pleased and touched that you thought to feature this paper, which tells me that more people are considering the focus on patients and how they educate us. I always think that my patient's my teacher
Yeah,
every day. So I really
absolutely.
appreciate that you're doing this. And it's such a pleasure to be able to talk about it and
Oh,
to see where it goes.
thank you. So would you like to add anything that maybe we missed?
I don't think you missed anything. I think you asked
Okay.
the very specific, important features of where do we go next? What
Yeah,
will we learn? And I hope to come back to
I
be able
would
one
love
day to
to.
tell you what we've learned.
Absolutely. And I want to see it used and hopefully it'll be responsive and that will have drugs that actually patients will use because they feel better.
Yeah, well, that's one thing I will add is that we are in an unprecedented era of therapeutics. And
Yeah,
so, as you know, there is a complete resurgence of, or maybe surge of interest in dermatomyositis, sometimes maybe to the detriment of having so much at once with a rare disease. So I think we need to think about that carefully. But in the advent of cellular therapy and everything
yeah,
coming down the pike, I think that a responsive measure like this will be so important to test in those trials.
great. So I really want to thank you. I want to thank Dr. Lisa Christopher-Stine for taking the time to review the findings of this paper and the implications. And for our viewers and listeners, I really strongly recommend you read the complete article titled The Dermatomyositis Disease Symptom Questionnaire, DM-DSQ, a measure to assess the patient experience of dermatomyositis symptoms. There's also an accompanying editorial titled Measuring Patients' Lived Experience of Dermatomyositis Symptoms by Doctors Ardaland and Ryder from Duke University Medical Center, Durham, USA, and the NIH at Bethesda, Maryland, USA. And you get a theme from the names of these papers and the editorial, what really matters. And these are available on the journal's website at jroom.org and will be in our print edition of the journal. And I thank you for joining us and hope you will join us next month when I speak to an author of another article of interest in the January 2025 edition of the journal. And please listen to the complete one, not only at the website, but on our YouTube channel. And if there are any comments, please send them to x@jroom or by email to manuscripts@jroom.com. Thank you.